Hypoxia, or lack of oxygen in cells and tissue, can happen in a number of ways, and ischemia is one of them. Isco means restraint or suppression, and emia refers to the blood. So ischemia must mean some kind of suppression or reduction of blood flow to an organ or tissue. And blood carries oxygen, right? So when there's a reduction in blood flow to cells, that also means there's a reduction of oxygen to those cells, and this is due to the lowered blood flow in the blood vessels. This lowered flow could be from something blocking the blood from the inside, or it could be something compressing the blood vessel from the outside. An example of something blocking the vessel from the inside is a thrombus, also known as a blood clot. These are solid clumps of platelets and fibrin that obstruct blood flow. Ischemia resulting from something outside the blood vessel is traumatic injury, which can cause inflammation and swelling that physically applies external pressure to the blood vessel, compresses it, and restricts blood flow. Alright, so let's say that this is your artery, and it's like the one-way highway leading all these red blood cells into the city, which is like a major organ in the middle here. So maybe this is Organopolis. These red blood cells are super pumped for their day, where they can drive around the capillaries, like the smaller city streets, and supply the city with fresh oxygen and pick up waste. And this Organopolis is made up of thousands of cells, like homes, that use up the oxygen and create waste that needs to be picked up. The deoxygenated blood cells drain out through different small streets, which are the veins, and go back towards the heart. So one way this organ city could become ischemic is if there's some obstruction to arterial flow into the tissue. Now only a few red blood cells can get in at a time. You might imagine that Organopolis sees a lot less blood and a lot less oxygen, and becomes ischemic. A super important and well-known example of this arterial ischemia is atherosclerosis, where plaque builds up in the arteries going to your heart tissue, which blocks arterial flow, reduces the amount of blood and oxygen that makes it to your heart tissue, and causes ischemic heart disease. Since you can have a blockage of red blood cells coming in, you can also have a blockage of red blood cells going out, leading to a decrease in blood drainage on the venous side. So in this case, you've got a major obstruction in the venous highway leaving the city. So say that these are like the veins draining blood out of Organopolis. All these workers are getting into Organopolis, but they can't leave because there's this blockage heading out, and traffic gets majorly backed up, causing flow to slow down throughout the whole city. This again leads to less oxygen to the tissues and ischemia. Thinking about an organ, it might get so congested that pressure can rise, causing fluid to get forced out of the blood vessels and into the tissues, generating edema. This whole example is very similar to Budd-Chiari syndrome, where the hepatic veins that drain blood out of the liver are blocked by a thrombosis, or a clot. And now blood can't flow through the liver, and the liver tissue becomes ischemic and can lead to liver edema and hepatomegaly, or enlargement of the liver. If the oxygen supply is low enough for long enough, it can cause cell death, and if enough cells die in a region of tissue, we would call that tissue necrosis and infarction. In some cases, there are areas of tissue that are getting close to infarction as cells begin to die off, but they're still able to get saved if they receive blood. This high-risk area that's teetering on the brink of death is called the ischemic penumbra. In some cases, there are two arteries serving a single area of tissue. And this goes against how we often think about tissue as being served by a single capillary bed from a single artery. But when you think about it in 3 dimensions, there can be a lot of overlap, right? If there are these secondary or collateral arteries going to the area, then there might be enough blood flow to keep the penumbra alive for a while. Over the course of weeks to months, these secondary arteries can even grow in size to bring more blood to that area, a bit like disaster relief. This process is called collateralization. So if blood flow to an organ is blocked all of a sudden, a super important concept to keep in mind is called time to reperfusion. This refers to the importance of reestablishing perfusion to the affected organ before the cells die and the ischemia becomes irreversible. Remember that perfusion and blood flow are slightly different. Blood flow is the volume of blood flowing per unit time, like liters per minute. Perfusion is like a measurement of how much blood is flowing to a chunk of tissue per time. So it might be given in liters per minute per gram of tissue. So as an example, if you compared the total blood flow to the kidneys with the total blood flow to the liver, it'd be higher to the liver because the liver is a lot larger. But if you took a 10-gram cube of liver tissue and compared it to a 10-gram cube of kidney tissue, the kidney actually has higher perfusion, since it has more blood vessels packed into its cube. Now, Back to reperfusion. If perfusion to the area is reestablished quickly enough, then it's possible that the ischemia is reversible because the cells were dying, but they're not dead. If too much time has passed and the cells have actually died, then the ischemia is irreversible since you can't bring back dead cells. One example of irreversible ischemic damage is something like a heart attack or a myocardial infarction, where an artery supplying a specific part of the heart with blood becomes blocked, causing death of that part. Depending on the area that's affected, this could cause serious heart dysfunction. Like if enough of the heart's ventricle was damaged, it might not be able to pump blood as well anymore.